Thanks for that generous introduction and the opportunity to talk to you about my research on how to use walking aids safely. So some of you might be thinking this is an injury prevention session. Why am I talking about this? Clearly someone's already been injured, but I'm actually all about preventing that second injury. So I know for me that it's hard to do these virtual conferences and sessions. So I have a very important skill testing question to see if you're all awake and paying attention. What did Kobe Bryant, Justin Trudeau, and Sir Tom Moore all have in common? Well, at some point they all used a walking aid, like a crutch, a cane, or a walker, and we see these devices everywhere. Nearly 3 million Canadians use walking aids for long-term conditions like cerebral palsy, lower limb amputation, or spinal cord injury, and hundreds of thousands of Canadians use them every year for a temporary injury like an ankle sprain or hip replacement. Now, obviously, walking aids can have a lot of benefits. They help to offload the lower body to reduce pain or compensate for weakness. So they enable people to do things like run a marathon on crutches. They improve sensory cues. They can also improve people's balance. And they enable people to move around in an upright fashion. So that limits the risks of things like lying in bed or sitting in a wheelchair. That can cause things like muscle wasting, which we've talked a little bit about already today, or skin breakdown. But walking aids also can have potential risks. So one of the most important things that people don't realize is that walking with a walking aid actually requires quite a bit of extra attention. So this is an important consideration when we have patients who have some sort of cognitive impairment, or even people who are feeling drowsy. It does take a little bit more to pay attention. Where are you going to place your walking aid? Walking with walking aids also often takes a lot more energy than walking without one, because you're using your arms and loading them in a much more energetic way, moving your torso in a much more energetic way. So we really need to consider that in people who might have underlying heart or lung problems. Many studies have also shown that even though walking aids can improve our sensation of where things are in space, they can also increase the risk of falling. So that's through things like how it affects our attention. Sometimes when using canes or crutches, you're just making contact with the ground with a very fine point. So that can be a bit destabilizing. And some people will just trip over their walkers or their crutches. So this has been reported to lead to things like head injuries, dental fractures, skin lacerations, and sprains and strains. We also have to think about people who might just be putting weight on one leg to totally offload the other leg. And so now their good leg might be exposed to different forces or increased forces than it normally has been. And so this can cause things like knee injury or ankle injury. And the last thing to think about, and this is where a lot of my research has been done, is that using a walking aid obviously results in different forces being put through the upper body than if people aren't using walking aids. And so this can lead to extra stress on joints, bones, nerves, and blood vessels. And this can lead to injury or even just pain at the shoulder or the wrist. So we have to step back and remember that people who are using walking aids already have some form of mobility impairment. And if we add on any of these other issues, this can really affect the rest of their body. So it can worsen their function, their quality of life, and their independence. And as Leisha mentioned, I'm a physiatrist, so I'm a medical doctor that works with people with different injuries and disabilities. And I care a whole lot about quality of life and independence. And that's what makes me just so passionate about this issue. So just to give you a flavor about what kinds of upper body injuries might happen, this is a paper that we published this year on injuries reported in the scientific literature related to using crutches. And we only found about 622 injuries. And that's actually because most of these injuries don't even get reported. So unlike things like getting a pacemaker put in, if there's a problem with that, all the physicians have to report those problems to agencies like Health Canada. But when there's a problem with things like your walker or your crutch, that doesn't have to get reported by anyone. And we know this is an underreport because a study in America looking at pediatric emergency departments over a 17-year period found over 21,000 injuries coming into emergency departments related to walking aids. And that's in children. Obviously, adults use even more walking aids. So I'll just tell you about a small part of that paper where we looked at injuries related to using auxiliary crutches, and that's where most of the injuries were found. So we found about 600 injuries there. About 50% were related to that pressure from the axillary bar. So these crutches are the ones that most of us have seen in Canada. Most people get them after an ankle sprain or after knee surgery. The bar can put a lot of pressure on those structures in the armpit. So in the yellow, we see the nerves, the red is an artery, and the blue is a vein. So repetitive weight bearing through that armpit can actually cause damage. And the most common injury we found were related to permanent or temporary nerve damage in that armpit. We also found quite a few injuries causing that red artery to either stretch out or to get really narrow, and sometimes to even clot off. So that can be pretty devastating for patients. We also found a few rare injuries. So there were 8 reports of traumatic brain injury related to falling while using these crutches. 2 patients actually, because that red artery clotted off, needed to have an upper limb amputation. And we talked a bit about the energy cost of walking with walking aids. And so one patient was in hospital learning how to use the crutches, and they unfortunately suffered a heart attack, causing death just because of the amount of strain on their heart. So in that paper, we looked at risk factors for injuries, and 2 big risk factors emerged. So number 1, if people weren't properly fit with their devices, they were more prone to getting an injury. And in particular, if their crutches were too long, it caused more pressure in that armpit area. We also found that if people weren't taught how to use their crutches properly, that also increased the risk of injury. So a lot of patients hadn't been told you're not supposed to actually lean on that armpit bar when you're walking on your crutches, which a lot of people don't know. I see that all the time in my clinical practice. And so these are similar factors that have been found related to walking aid injuries with other types of walking aids, and that led me to create this app. So it's exciting. We're just kind of launching our app today to the public, but our app is called Improving Canadians' Walking Aid Learning Skills and Knowledge, or I Can Walk. And I really encourage you to check out our website to learn a bit more and download the app. But our app really helps fill a gap in how we teach patients and their caregivers, how we teach clinicians who might not know, and how we teach clinicians in training how to fit and walk with a variety of walking aids. And the app is very interactive, so it involves taking videos and doing some assessments. So I'll show you a video now, if you don't mind playing that video of how our app works. So this is an older version of the app where we only had 8 modules, but we actually have 20 now. So what the individual does is they select the kind of walking aid that they're looking at and what they want to learn, whether that's fitting or walking with it. So we'll see someone click on learning how to use auxiliary crutches and how to do a swing through gait, so not putting weight on their injured leg. And then they'll watch a video. And then they'll look at what are the components of the skill that I need to do. So they'll go through that, and then they'll end up actually taking a video of themselves or having a peer or their therapist, a clinician, caregiver take that video. And then they'll look at that video and compare side to side. And then they'll go through each of those components that were listed. So we'll take you through a few now. So they'll say, okay, am I wearing flat-soled shoes? So I think this person, when they looked at it, they said, well, there's a bit of a heel, so not quite. Are they putting the crutches about 30 centimeters in front of their good leg? And in this case, they looked at it, they said yes. Maybe they were taking their time to think. But that's the nice thing about this, is it's very interactive. Now are they landing on their heel? That's pretty straightforward. Yes, they were. Are they keeping their head up? So you can see initially the individual is not, but then later on they do. So they get a bit of a partial score for that. And are they making sure to, really importantly, not lean on that bar at the top of their crutch? And they are. So the nice thing about this is it can generate discussion between a patient and their caregiver, a patient and the clinician. But the patient also gets a score at the end, so they can see what they did well, what they might need to work on, and then they can keep on taking the same module again until they feel like they've mastered it and can move on to the next one. So I'm really excited. Our app currently costs around $4, and that's just to help us cover the basic charges. But because we're launching it today to the public, we're making it free for the next 2 weeks. So I'd really encourage you to download it. Give us some feedback on our website, because we really want to make this app great. And my big goal is to actually make this available to all Canadians for free in a sustainable way. So I am actually looking for a sponsor or a donor to help us out with that. I think a lot of people, if you've ever gotten crutches in an emergency room or tried to help a family member get a cane at a drugstore, a lot of times people just aren't fit with these devices properly. And I see it in my clinic all the time. It'd be nice to have something quick and easy where people can kind of teach themselves or teach each other. I also think it's really beneficial for parts of Canada that are rural or remote, where access to therapists might be a bit more limited. I've also applied for a few grants to really research, does this app actually change outcomes for patients in a variety of hospital and clinic settings, both in therapy clinics and in medical clinics. And some other research that I've done has shown that particularly nursing and pharmacy students don't get a lot of education on walking aids, how to fit them, how to use them. But these are the people that are giving walking aids in a lot of acute care settings. So can we use this app to really change their training? Can we really use this app to help nurses or pharmacists or even therapists who don't do this a lot develop their skills after they've been working through continuing professional development programs? So with that, I'd like to thank the very many team members who've helped me put this app together and do a lot of my research. And I hope that you're now just more open to think about how walking aids can potentially cause some harm if they're not used safely, and that you're motivated to help me in my lifelong quest to change that. And I look forward to answering any of your questions. Thank you.